Dear all, nice to meet you again and welcome to this new webinar of our series. And today I'm very proud and glad to have with us two very valuable speakers, two people that we have to thank because without them we're not able to have this connection between European Union and Ukraine. It was not possible without them to have this series of webinars as well as the future activities of for the CTMS for connection between healthcare provider in Ukraine and healthcare provider in European Union. And two very valuable speakers, but also two mainstay for our activity. Professor Wertelecki, it's quite difficult to summarize its long curriculum vitae and his expertise is a life of study and about genetic epidemiology, pediatrician, and also about his role for OmniNet program in Ukraine and for the Spina Bifida. And Dr. Sylvia Rosen, and she is the General Secretary of International Federation Spina Bifida and Hydrocephalus. And I believe that I can represent the gratitude of all of us for their great role. And today the webinar is focused on the epidemiology and prevention on Spina Bifida in Ukraine. And I'm sure that you will enjoy this presentation and the discussion. And now I would like to leave the podium to my Dr. Zimak, my colleagues that help me in this role. Dr. Zimak, please.
Greetings. Thank you, Professor Mosiello. Welcome to the continuation of EU-Ukrainian webinar series on spinal dysraphism. This webinar series is hosted by ERN and Eurogen and supported by International Federation of Spina Bifida and Hydrocephalus and OmniNet Ukraine. This webinar is eligible accreditation for those who attend the live session and complete the post-session survey. To our Ukrainian participants, in the event of an air raid alert in your area, please take shelter immediately. A recording of the webinar will be available later. Today, we will talk, as you know, about epidemiology of Spina Bifida in Ukraine and the prevention of neural tube defects. And our today outstanding speakers are Professor Volodymyr Vертелецький and Dr. Sylvia Rozен. Professor Wertelecki is a pediatrician and medical geneticist. He is an international director of OmniNet programs in Ukraine and a member of American College of Medical Genetics and Genomics, American Society of Pediatric and Pediatric Research, American Academy of Pediatrics, and correspondent member of Academy of Medicine, Buenos Aires, Argentina, and Academy of Sciences, Ukraine. And Dr. Sylvia Rozen is the Secretary General at the International Federation for Spina Bifida and Hydrocephalus, head office in Brussels, Belgium, represents people with Spina Bifida and Hydrocephalus and their families worldwide. Together with IF's members, board members, secretariat, and public-private civil partnership, Dr. Rosen is dedicated to building positive futures for people with Spina Bifida and Hydrocephalus. Also, it's my pleasure and privilege to introduce my co-moderator, Professor Giovanni Mosiello, Director of Training Center for Pediatric Urologists on behalf of European Board of Pediatric Urology, Director of Training Center for Pediatric Neuro-Urologists on behalf of International Continence Society, Chair of Working Group on Spina Bifida of European Reference Network, Eurogen, and Ithaca. Now,
Thank you, Dr. Zimak. I believe that we have to leave the podium to our valuable speaker, because I believe that everyone is very anxious to hear them, because I believe that today is where we will receive some very precious and interesting notice in order to understand this specific situation of Ukraine, and of course, thanks to Dr. Zimak, Dr. Roozen, also how to correlate this situation to the Spina Bifida worldwide. Thank you. I am very proud to introduce Professor Wertelecki. Please, the podium is yours.
Greetings. It is a pleasure for me to address this audience composed from colleagues from Europe, elsewhere, and in particular from Ukraine. I'm very grateful for this opportunity to join this series of webinars offered by multiple European organizations, including OmniNet Ukraine, which is an international effort with long-standing presence in Ukraine. We are called OmniNet, and our fundamental mission is to serve as a center of information and education. The subject today, as is well known to you, is Spina Bifida in Ukraine. And in Ukraine, unavoidably, that includes attention to what Chernobyl is or is not. It is self-evident that the issues related to Chernobyl are complex, including its potential impacts on embryos and subsequent developmental anomalies. In the context of the present series, our emphasis is going to be on Spina Bifida and what we know about it in Ukraine. Due to limitations of time, this is part one. Part two of this presentation will follow a week later and will focus on a broad spectrum of Chernobyl impacts. So please be aware that you could subscribe to part two, as we are going to indicate shortly. My presentation today will be followed by that of Dr. Sylvia Rosen, the Secretary General of the International Federation for Spina Bifida. This distinguished colleague will inform the audience about the World Health Organization resolution regarding folic acid to reduce the impacts of Spina Bifida, and also the critical, essential, and absolutely necessary participation of parental support groups for the success of such initiatives. Following the presentation of Dr. Rosen will be one by Dr. Natalia Zimak-Zakutnya, a director of the Khmelnytsky City Children's Hospital. This hospital is a national reference center for Spina Bifida, and I think our colleagues from Ukraine should pay particular attention to this feature. Dr. Natalia Zimak-Zakutnya is not only the director of the Khmelnytsky Medical Center, Children's Medical Center, but she is also the director of clinical genetics for OmniNet in Ukraine. As a pediatrician, she has made multiple contributions to the well-being of Ukrainian children. First, a few words about OmniNet and the precedents related to it. The organization of the OmniNet began in 1986, shortly after the Chernobyl disaster. It didn't prosper because the Soviet Union was blocking access to Ukraine, in particular to Volhynia. In 1991, Ukraine declared independence, which opened access to international experts to collaborate with Ukrainians. We were invited to make a presentation to the United States Congress, which eventually resulted in initial funding by the USAID, endorsement by the March of Dimes Foundation, and altogether, including with European organizations, we visited Kiev to create an agreement with the Ministry of Health. What it was proposed was a population-based surveillance of all newborns for developmental disabilities. This surveillance is unlimited to the categories surveyed, but in practical terms, it is focused on 111 categories of developmental disabilities. The condition was that they should be detected utilizing international standards, which were not upheld by the Soviet Union. And to measure that as fulfillment or as fulfilled, OmniNet had to prove that it could join international organizations, including EuroCat. We are full members of EuroCat, which is a monitoring system similar to the one in Ukraine across Europe, United Kingdom, and Ireland. Concurrently, because of the high use of alcohol in Ukraine, we initiated a collaborative investigation with the National Institute on Alcohol and Drug Abuse of the United States. So this is in short who OmniNet is. The central mission is to become a data resource and an information center for Ukrainians. The tactic to achieve the information dissemination of the results of the ongoing surveillance of infants, we rely on quite a few websites, icons of which are displayed here, 5 of them, there are a few more. And Spina Bifida is included in the contents of each of them. You are invited to visit these websites because they are accessible free of charge. For example, past webinars, including now the present, are offered through channels of YouTube, most of which are bilingual, that is, English presentations are also available in Ukrainian. Presently, there are over 196 tutorial videos, and again, you're free to visit them. The link is shown. In this screen is emphasized one of the websites I like to overemphasize. It is a website in Ukrainian about medications that may harm the unborn. For instance, anti-epileptics increase the frequency of spina bifida. This website has attracted hundreds of thousands of visitors from Ukraine, mainly pregnant women. It seems to me like most Ukrainian clinicians should know that this website exists. It's one of the unique ones in the world, and it includes the risks associated with medications that each physician may be prescribing to a woman that is not even aware she is already pregnant. For example, let's suppose we are focused on dilantin, which is one of the teratogens that may manifest as a neural tube defect. Extensive information is available in another website called International Birth Defects Information System, with the link shown below. In this website, multiple specialists can post their points of view. In this website are shown the selected and best sources of information on this subject. And we invite Ukrainians to make contributions in Ukrainian, as you can see on the right, or in English, on any subject related to developmental disabilities. Focusing on Spina Bifida, I think it is proper for me to inform Ukrainians and non-Ukrainians alike that in the near past, there were dedicated 10 webinars to this subject, that over 1,000 participants, active participants, were interested, and that 3 times as many viewers visited these websites post facto, which underscores the importance of making the contents of webinars available through the internet. This webinar will be recorded, this webinar will be posted, and this webinar eventually will be translated into Ukrainian, and both are going to be available in the YouTube channel of Omninet. So, Spina Bifida, Chernobyl, implying ionizing radiation. We have known since 1929 that radiation is dangerous for babies, that pregnant women subjected to X-rays may deliver babies with spina bifida or microcephaly. We have known that since 1929, there is nothing new about it. And for those who wish to know facts more accurately, here is what a Dr. Murphy observed in 1928. He investigated 53 women exposed to in utero irradiation. Among these 53 embryos, 27 had small heads, microcephaly, and 13 had spina bifida. There is nothing new. Also, however, this is an emblem of an enormous public health victory. In a very short time after this discovery, the medical policies introduced the warning that pregnant women should not be exposed to radiation. A victory of the ethics and responsibility of the medical profession. But is Chernobyl radiation? Should pregnant women be exposed to Chernobyl radiation? We'll talk about it. The International Agency for Atomic Energy, which automatically is endorsed by the World Health Organization, considers that that's not relevant, that Chernobyl could not possibly be a cause of spina bifida. Such statements are not supported by investigations in Chernobyl areas that were impacted by Chernobyl areas. So, why not Chernobyl? Is it just a hypothetical, theoretical position? Yes. Omninet was created for many reasons, but among them was, does Chernobyl cause developmental disabilities? Yes or no? And that includes spina bifida. Here is a map of Europe and all the network of Eurocat, of which we are full members. This adds credibility when we monitor disabilities in Ukraine the same way like in Paris or Berlin or London or anywhere else. I think it's important to underscore that Spina Bifida in Ukraine, its frequency is elevated above all the other areas in Europe. Sort of a provocative contrast. The following observations of thousands of patients and thousands of women who underwent measurement of their incorporated radiation would not have been possible, and therefore we must acknowledge with gratitude most healthcare professionals in Rivne who voluntarily participated in our efforts. Furthermore, this was made possible by an endorsement of the Ukrainian Ministry of Health and contributions of a large host of international experts. Thank you to all of them on behalf of all members of OmniNet. So let's look at some facts, not hypotheticals. In Rivne, there were 320 infants with spina bifida, representing about 5% of those across Ukraine, meaning that in Ukraine there were about 6,400 infants with spina bifida. That is not a small number. That is an epidemic. Neural tube defects, to which spina bifida belongs to, were observed in 542 infants, representing at 5% frequency in this province of 10,800 in Ukraine in general. Well, let's look a little further. Spina bifida and polyscia, the frequency based on a population base, that is among all Ukrainians, all Ukrainian infants, that is, represented 12.6 cases of spina bifida among 10,000 births, much more frequent than in North Polyscia, which among 10,000 births was about 8.67 births. And in Europe, among 10,000, there were infants with spina bifida born about 5 times in 10,000. Why? Ask why. And can it be reduced? Answer, absolutely. The frequency in polyscia and not polyscia should be less than 5, because it is lower in countries that fortify flour with folic acid. So, fact 1 is hardly disputable. Spina bifida is highest in an area polluted by Chernobyl. Well, maybe it is due that the women drink more there, and therefore that's why you have it. They worry about the radiation in polyscia, so they drink. No, but actually, when you measure pregnant women and how much in their body is their cesium-137, you see it is 3 times higher than in North Polyscia. Each molecule of cesium-137 explodes in that mother, explodes inside of that embryo, and causes damage. On another perspective, while some women eat more radioactive cesium than others, women that love to eat mushrooms may have more incorporated cesium than women that don't. So here is another statistic. Women that have over 100 becquerel explosions per kilogram of their body weight 382 in Policia compared to only 8 in not Policia. What kind of babies are they going to have, these 382 pregnant women? How many of those babies are going to be dead? How many will have spina bifida? Is that something we don't want to know? Ask yourself. So we come back to the same question. Women should not be exposed to radiation, whether they know it or not. They may be pregnant. In fact, you should not be exposed to radiation because it's carcinogenic. But we're talking about babies. We're talking about embryos. Why not Chernobyl? What's wrong? We know that radiation will cause spina bifida and microcephaly. Why not? We should perhaps explore that further. So here are some facts. In Policia, spina bifida was statistically significantly more frequent. In utero exposures to radiation of embryos was statistically significantly higher. In Policia, other NTDs, such as craniorachis were statistically significantly higher in Policia. In Policia, microphthalmia and microcephaly were statistically significantly higher than in North Policia. So how many facts do we need? And we have them. Why not Chernobyl? We're going to talk more about the why not in part 2. But since this part is focused on spina bifida, let's talk about 2 things we can do right now, tomorrow morning. It cannot be done without you. It cannot be done without Ukrainians. This is not the responsibility of Putin or any government. It is the responsibility of everybody. 1, we can reduce radiation exposures by eliminating the sources. And the sources are water and nutrients polluted that pregnant women swallow or inhale. The Ukrainian government has discontinued the monitoring of the sources of radiation for pregnant women in the areas contaminated by Chernobyl. Why? Well, they follow recommendation of international agencies. Why? Find out. The second thing we can do is to reduce the frequency of spina bifida directly. How? By adding folic acid to flour. Well, why to do that? Well, there are over 100 countries that are doing this, and you're going to hear more about it from Dr. Rosen. And they all have demonstrated that it is safe and that it is effective. Why don't we put folic acid in flour in Ukraine? Why? Ask yourself, why? So I have run out of my time. We'll continue in part 2, exactly 1 week from today at the same time. Registration announcements will be promptly followed this webinar. And I hope I see you then. But before, I have a few little things to add. So, OmniNet, as stated, was dedicated to science, to find out facts, and to disseminate information, how to diagnose, care, and prevent developmental disabilities. But things have changed. The change is war. And during war, OmniNet has to change. And the change is that we need to shift our attention to assistance, to care. And to do so, we need your help in order that we can help. We can help others, but not easily without your help. And are we doing something? Well, we are doing quite a bit, given that our resources are very limited. We are not a state institution of any kind. We have no connections to any government, and therefore our resources are minimal. But we have distributed over 25,000 urinary catheters free of charge, and pay as we may. We pay as we collect a few dollars here and there. But we cannot afford to buy cerebral shunts. It's sort of a halfway help. You know that Spina Bifida has problems with the urinary tract, and that's exactly what these websites are about. But they also have hydrocephaly. Are we just champions of a half patient? We don't want to help the whole patient. We just want to help the lower half and not help the upper half. It doesn't make sense, does it? Very often, professionals say, well, why don't you call so-and-so? Why don't you write so-and-so? Why don't you ask for help from such and such agency? Yeah, sure. We can do so. So can any of you. But the issue here is that our professional colleagues should have their own sense. They can make a personal contribution more than just recommendations. So I invite you to join other professionals, because without them, we would not exist. Help us to help others. And now I wish to thank you for your attention and invite you to see part 2. And of course, to make a personal contribution so we can continue our work. Thank you, and thank you again.
Thank you, Professor Wiertelski. A very nice, interesting presentation. Very interesting for the question that you raised, and questions that in my mind are not only related to Ukraine, but can be present everywhere worldwide, as the role of medication and so on. But we have received some questions, but I would like to leave discussion at the end. I would like to invite Dr. Sylvia Rosen, and please, and with your presentation on the role of a preventive effect of folic acid. Thank you very much. The podium is yours.
Thank you so much, Dr. Mosiello. And it's really a pleasure also for me to be here. And of course, it's really nice to see you all here, because our partnership is of great importance. And with this virtual webinar, we really aim to facilitate discussions among healthcare professionals, both of European side and Ukrainian side, to talk about the support to patients with rare and often complex conditions such as Spina Bifida. Following the previous well-presented presentation by Professor Wertelecki, I will give a modest contribution to bring a broader perspective to underline the importance of multi-stakeholder engagement to support person-centered health outcomes, and I will start also by a focus on prevention. As you already know, the IF, the International Federation, is the international representative organization for persons affected by neurotube defects and their families around the world. And we therefore work with and on behalf of our over 100 member associations worldwide, often led by parents. Our vision is a society that guarantees human rights of all persons with spina bifida and hydrocephalus, including health equity for all. And for this, the collaboration with you is very important, as you can see on the slide here, to leave no one behind. And Omninet in Ukraine, as well as the Parental Association Lights of Spirit, are important local and regional partners for us, because you are in fact actively working with these principles. And the needs of persons affected by these conditions are always ahead of us, but yet in our work we keep behind. But I think today and in the other webinars, we have an important role to engage as multi-stakeholders to realize health outcomes, in particular when we talk about prevention and optimizing management and care. And as Professor Wertelecki already mentioned, care comes first and prevention second. Next slide, please. The best practices aimed at both prevention and care to improve the quality of life reflects a broad domain. As you can see here, when you zoom in on a health problem, one sees that the challenge is multifaceted, and that really requires a multi-stakeholder perspective. And therefore, there is quite some work for our Ukraine partners, both Omninet together with the parental groups and other professional organizations. In the next slide, please, if you look at the prevalence estimates, we already heard about it in the Ukraine situation, but globally, from the most recent data that we have from review studies, we see that the estimated prevalence is 18.6 of affected birth outcomes per 10,000 live births. That is roughly 1 in 500 births globally. But what is important is that what we see, that countries that fortify staple foods with folic acid, they have lower prevalence estimates. In the next slide, I just show it to you for your interest. When one looks at data, when one looks at prevalence data, there's always cautious interpretation necessary, given the common challenges that these studies sometimes have, such as heterogeneity of when we look at the diagnostics of NTDs, but also the variation in prevalence estimates. But what is important also here is that the data nonetheless is very informative for both actions on prevention and care. But a picture speaks more than words. So if we can have the next slide, please. I think here it comes more apparent of if you put Ukraine in the perspective of other countries, in this case the European region, you see that in the upper line, the prevalence rate of spina bifida in Ukraine compared to Europe, that the data is quite persistent, different, and in the current circumstances, it will remain an epidemic in need of both prevention and care. And unfortunately now, for the Ukraine, we have to deal with a complete other situation, as was already mentioned in the previous presentation. In the next slide, please, if you see in this graph, you see that different countries around the world have different prevalence estimates for birth defects if you compare it pre-fortification of staple foods versus post-fortification of staple foods. And the best example you can see on the right for the Oman situation. So there is significant evidence there that when one fortifies the foods with folic acid, that we see the reduction in prevalence estimates. In the next slide, I show you a publication with a clear message. We cannot make it more clearer than this, that despite the situation, the cost of inaction is profound. And this study also suggests that the failure to implement mandatory folic acid fortification in the 28 European countries has caused and continues to cause neurotube defects to occur in almost 1,000 pregnancies every year. So that message we cannot ignore. The next slide, please. It is for this reason that we have been a vocal proponent for large-scale food fortification with folic acid for decades. And as part of that advocacy journey, we have worked with different partners to bring to the front a strong resolution on fortification with folic acid to reduce the prevalence of spina bifida and other neurotube defects, which we have proposed towards the World Health Assembly. And that resolution is calling upon all member states around the world to take urgent action. For instance, by promoting healthy, balanced diets and nutritional education for all populations, including a regular health and promotion of maternal and child health programs. Another action we demanded is making decisions on food fortification with micronutrients and or supplementation, also establishing systems for newborn screening, diagnosis and early management, as well as finding appropriate ways to strengthen the financing mechanisms and other enhancements for food fortification and or supplementation. Now, the proposed strong resolution has reached a success in 2023. And you see that on the right picture. That is the approved World Health Assembly resolution by the World Health Assembly Executive Board in 2003. And as you can imagine, it's really a tremendous milestone in achieving our goal. The campaigning for this resolution has raised awareness, of course, on the importance of cross-sector collaborations for public health policies advocacy. And this couldn't have been possible without the representative groups and the majority parental associations as being very strong civil society actors. Now, the advancement on such an international level cannot be achieved without progress on local and national levels. And representative groups play a vital role in this advocacy journeys, especially by the persons affected by spina bifida and hydrocephalus, as well as their families, to emphasize, one, on the need for policies such as these, two, the demand for change and keeping in mind a human rights-based approach, and three, requests for equal partnerships, effective monitoring and implementation processes. Therefore, from our perspective, this achievement reflects a journey of over 40 years of advocacy to bring awareness on the important role folic acid can have in prevention. And our community is the one, in fact, that benefits the most of these policies and therefore important advocates to make change happen. It's now up to all of us, because the policy, the highest achievable policy on global level is now in place, but it's really up to us now to monitor the progress and its success. On the next slide, I just give you an overview of the progress that we are making so far. So therefore, this chart can be quite informative. If you look at the colors around the world, you immediately see that we still have a lot of work to do, and also in the European region. But what is now unique about the World Health Assembly resolution is that it combines policies to approach a serious public health crisis with a holistic approach. Not only the perspective from nutrition, but the combination from the fields of disability rights, healthcare, and nutrition. The next slide, please. Our collaboration, as we are sitting here, reflects the need for combining perspectives. And when we speak about primary prevention, we immediately also need to speak about secondary and tertiary prevention. And as was already emphasized, we need to focus on care and secondly, on prevention. And if you have a look at this boy, for instance, this is in fact what we have been discussing in the past webinars. The leading principle is always the improvement of care, whereby it is important to assist a person with disability into a person with ability. On the next slide, I just share with you how we underscore these important messages. The recent example is our anniversary 30th International Conference with a so-called Kuala Lumpur Declaration. That's another type of policy document which reflects these arguments and principles that we're talking about. So when we talk about prevention in this case, we also need to talk about improvement of care. The next slide, please. As we saw earlier, and I'm coming to a conclusion on this slide, as we saw earlier, the inadequate actions have profound effects on persons with spina bifida, hydrocephalus, and their families. And together, both healthcare professionals and parental associations, we have an important role to engage with multi-stakeholders to realize health outcomes. Now, the webinar today really reflects an important partnership with the ERN Eurogen, Omninet Ukraine, Kremelsky Hospital as being the Spina Bifida Reference Center also in Ukraine. And in different ways, nationally, regionally, and international platforms, opportunities exist to, for instance, exchange the knowledge that we have, but also to learn from one another through so-called twinning examples. If you were here last webinar from this partnership, you were also a witness of an important new system called the CPMS, as you can see here in the middle. And this new system provides you with a unique opportunity to connect with experts on rare diseases throughout the whole of Europe. And also in an upcoming webinar, the perspectives from lived experiences and the role of parental associations will be presented. So it's a very nice and fruitful exchange of the different perspectives and ways we can improve care. But while these webinars are always a starting point, we trust that you find these dialogues so helpful in support of your work. So from my perspective, I very much welcome the continued collaboration and ways in which we can be of support. And for this reason, I would like to thank our partners presented here today. And on that last slide, thank you. On the final note, I thank you all for your attention. And I give now the floor back to most probably Dr. Mosiello, Dr. Zemak. And I very much look forward to seeing each other in one of the upcoming meetings. Thank you.
Thanks to Dr. Roozen. Very good presentation, very clear. I believe that you answered to some questions that we received about the role of folic acid fortification. I would like to leave the podium to Dr. Zemak, and we have a very short time, but I believe that will be very useful to know the situation that on the ground by Dr. Zemak that is living the spina bifida in Ukraine every day. Please, Dr. Zemak, the podium is yours.
Yeah. Thank you, Professor Mosiello. I'd like to add a short comment mentioned by Professor Wertelecki in his presentation regarding our hospital. Our hospital is the largest hospital in Khmelnytsky region, pediatric hospital in Khmelnytsky region, and our hospital includes a newly created rare disease center specializing on muscular dystrophy, spina bifida, and tuberous sclerosis. Now, a member of National Rare Disease Network, Reference Network. As a member of Omninet, we have started from monitoring. We were included into population-based monitoring system on congenital anomalies, receiving full membership in EuroCAT monitoring network. And currently in our region, we follow up 43 patients with spina bifida. And we are grateful to our European colleagues and to Dr. Mosiello in particular for providing the expertise and care to our children who were forced to leave Ukraine due to war circumstances. Our hospital and our rare disease center is also a site implementing an OmniNet initiative on distribution-free urinary catheters to children with spina bifida, and our gratitude to all those who made their personal donations and encourage everybody to join and share their efforts. Thank you very much once more. And now we have time to discussions, and I see we have questions.
Yes, Dr. Zimak, we have received some questions, and someone is specific, and I have two questions for Dr. Roozen about the preventive effect of folic acid for neural tube defects and spina bifida, but I believe that you answered to this question by Irina. And I have other two questions for the folic acid implementation. If you know where in Europe we have this program regularly. For my knowledge, we have a program in the UK, United Kingdom, and in the other countries of Western Europe. Do you know how is the situation?
Yeah, maybe it's good to emphasize that food fortification is not the holy grail. So we are talking about that food fortification is very helpful as a primary policy, and which can be combined with other policies too. In the European region, yeah, on the mandatory food fortification perspective, we are not doing so well. However, the voluntary way of fortifying foods is certainly taking place. Also in some areas in the European region of which we don't know by the numbers, but in Switzerland, for instance, we have 250 food products which are voluntarily being fortified with folic acid. And exactly in the UK, we have quite some achievements there because a new legislation has been introduced for the fortifying the non-whole meal wheat flour with folic acid for the end of 2026. So that means that things are moving, but it's not so easy to make change happen on the mandatory side and on the policy side for Europe as a European Union. Yeah.
And one specific question to you by Katerina about the folic acid fortification in Ukraine, and how much could be useful? I believe yes, of course, useful, and useful only with folic acid or also with iron implementation. What is your...
Right. I think one part of the question is partially answered by Professor Wertelecki. It's a complex situation because folic acid is not the only answer to the health problem in Ukraine. But when it comes to supplementation and combining vitamins, that is something that you see often. If we promote folic acid, we also promote other vitamins because it's about healthy pregnancy. So that is a general message. Food fortification, combining different types of vitamins. You see it a lot with iron and folic acid, but the more you start adding, other complications come there, but that's more of a technical nature. So if somebody is very interested in such a question and more of a technical answer to that, I can get back to you, but then after this webinar, I would say.
Yeah, thank you very much. For Professor Wiertelski, your presentation was very, very interesting. I believe that you raised some points very interesting. The first one is my opinion, and it could be a question for you, and is related to the role of the teratology of medication. Because I'm not sure that in all countries, including Italy, and we are doing the best. Maybe there is some knowledge that we are losing during time about the risk of some medication, because we have a high number of people that use self-medication, and sometimes they don't understand or they don't know exactly the risk of the teratologist risk of this medication. And one question very interesting, I received two questions about that, about the risk of nuclear power plants of the comparing the risk in Fukushima and accident and the Chernobyl. And I know from the literature that for Fukushima we have a very discording data, because we have a study of a car in 2015 that represent an increased risk due for spina bifida after Fukushima, and other study from Japan, from Nishigori on 2022, of Fujimori on 2024, that not demonstrated this correlation. And I have one comment, and I would like to know your opinion. Is this correct for you to compare Fukushima and Chernobyl, because they are different disasters, this is my opinion, and maybe managed in different way, and compare the results of the risk after Fukushima, in my mind, is not exactly correct comparing to Chernobyl, because I can suppose that there was an higher exposition to radiation. What is your opinion, Professor Wertelecki? Please.
I don't know if you hear me, do you?
Yes, yes, we know. We hear you.
Well, first of all, the issue is not the accident. It's not Japan. It's how much radiation gets the embryo. Radiation is energy. So who delivers the energy? First of all, is it the direct exposure, physical, that goes through the mother, through the uterus, and reaches the fetus? Or is it through some radionuclide that the mother swallows, circulates, reaches the fetus incorporates that? The radionuclide is not energy. It has to explode. So it has to be how energetic is the radionuclide, how many explosions per second. And I showed you in Ukraine, there are a lot of explosions per kilogram of pregnant women. That's per second. Every second, 100 explosions. If they hit the wrong place, you're going to have the wrong thing. So in Japan, they didn't measure pregnant women. The first international policy should be that if you have any suspicion of an accident with nuclear release, you need to know who's pregnant. And you need to know who may be pregnant and avoid that they should be exposed. The second point is, I'm not an expert in Fukushima, but I can tell you that they disbanded the population without any epidemiologic planning. So they're scattered all over the place. It's not easy to put them back together. The reason we studied Policia is because it's an ecological niche. People don't come in and few leave. So it's a stable population. If you wanted to do this in Paris or in Berlin, how are you going to do it? They come in, they come out, who was there for how long, what did they eat? We had a natural laboratory to do this investigation. If anybody wants to know that this is not so, please come in and do your own investigation. But don't do it in Alaska or in Washington, D.C. We will welcome anybody to use our resources that are in place. We have 20 years of data. Actually, more than that, because we just finished the assembly of the data 2021, 22, and 23. And that's during wartime. So going back, I think the question is the embryo. The question is how many becquerels? This business of measuring radiation in a million different forms is destructive. Becquerel is a unit of energy. And all reports are calculations, they are transpositions, they are assumptions, they are models. That is not as good as a direct measure. Now, I can tell you that all nuclear power plants, good, bad, or indifferent, release tritium. And we do not know any means to stop it. Tritium is the smallest molecule you could find, and it will go through anything, through several meters of steel or concrete or whatever have you. It's an atom. In Fukushima, they're releasing billions and billions of liters of tritiated water, which is forbidden in all countries for people to swallow. But it's not the water, it's the radioactive hydrogen there. And so when somebody asks about nuclear power plants, it's not whether they leak, they all leak. The question is how much. Now, the only proof that nobody can dispute is that around nuclear power plants in Germany, there was an excess of childhood leukemia, and that's why they closed them. What you don't look for, you don't find.
I totally agree with you. This is very always true in medicine. If you don't find something, it's impossible to find. Thank you very much for your clarification. I believe that you answered completely to the question by Liuba about the risk and if it's correct or not to compare Fukushima with Chernobyl. And I believe that your point was very useful for all thinking about our daily life and how we consider the risk in our cities, because I'm thinking about, for example, to migrants. We receive many people from other countries, and most of them don't have a general practitioner that advise them for the risk of the teratology risk of medication or the risk for radiation, and maybe we have to improve education, and as well as Dr. Roozen presented before, to improve folic acid fortification everywhere. And thank you very much, because the presentation was very interesting. Compliments, because all of you were in the correct time for the presentation, and we will come back with the next one, and that will be with complication of neurogenic bladder in adult life. We will have Ukraine colleagues that is working and living in the United States, Professor Roger Domchowski, and I would like to thank again, and I would like to leave the podium to Dr. Zimak. Please, Dr. Zimak, for the conclusion.
Many thanks for our outstanding speakers for providing an in-depth look in that topic of Spina Bifida in Ukraine. And thank you once more very much, and see you soon.
Thank you. See you next month. Thank you again, Professor Wiertelski, Dr. Roozen. Thank you very much.
Goodbye to everybody.
Bye.
Be well.